Comes in here and he's finishing off a 2-liter of Diet Mountain Dew.
Yep.
Sometimes he will bring a 2-liter of Diet Mountain Dew for us and insist adamantly that we drink it right away. We're like, we don't understand.
Or else.
This is, like he's like, drink it, it's good. Drink it. We're like, but we'll get too
much caffeine.
We'll
never
too much
sleep.
caffeine. No, it's good. Drink it. How many do you drink a day?
I have about 1.5 gallons a day.
Yeah.
No,
well,
that's not good for you.
That's 90 ounces? Yeah,
he's got to stay alert.
Yeah, absolutely.
He's performing surgery. Hello.
Don't your hands get shaky?
They really don't.
Yes.
They really don't.
His
I've got a
hands get
tolerance
shaky.
probably for it. Yeah.
Yeah, I'm sure you build up a big tolerance.
I've got 10 bottles of each in my trunk. If you want to go out afterwards, I'll give you one of each. How's that? Diet Coke and Diet Mountain Dew.
I don't think he was listening at all.
No, not at all.
But Dr. Workman does listen when you come in and have a question about questicle?
Questicles.
A plastic surgery question. Why, he'll listen and never advise more than you need. Hurricanes with female names kill twice as many people as hurricanes with male names.
True.
Yes.
Yeah. You know why?
Well, it wasn't a question. It was a fact.
Really? Factoid.
Why?
What I read is because for some reason people don't prepare as much.
Right. They are not as
Hurricane
afraid.
Susie doesn't frighten you. Hurricane Hugo, you
they're
board
like,
up the window.
Hugo's going to do some damage.
Wow.
Is this scientific or something?
Science.
That's like,
fact.
Science.
Like Jeff, the weather guy in Florida, came up with.
Clownfish, like the one in Finding Nemo, change from male to female if they need to for reproduction. So in the movie, once Nemo's mother was killed, his father would have then grown female sex organs and started reproducing with Nemo.
Really? I hate it when that happens.
That's not good
No
for
wonder
anybody.
Nemo
Our
hid.
videographer Jason is nodding his head enthusiastically. I don't know why.
Well, that's kind of weird.
Oh, man.
So let's talk about sex organs a little bit.
Okay.
Secondary sex organs, those being the breasts.
Okay.
Actually,
Latites.
when that's right.
How French of
The
you.
scientific name on it. If you are a breastfeeding person and you don't plan to have any more kids, how long after you finish breastfeeding should you wait before you decide that you want your breasts either lifted or a breast implant, or do you need to wait?
No, I think you should wait. Normally, we like to wait 3 to 6 months because we want the breast to be kind of in equilibrium. Normally, with breastfeeding, they get real large from the milk production. But oftentimes, with pregnancy, we put on a lot of weight. We have more fat in our breasts. We kind of want to get you back to a stable weight.
With talking about weight gain in pregnancy, is it true that you lose weight through breastfeeding? Have you ever heard that before? Or is that just something that happens to some women and not others, and they
I think that's urban legend.
Yeah.
I think as long as you're eating fine, I think that you probably shouldn't be losing weight when you're breastfeeding per se.
Another thing, post-pregnancy, when you say you have gained a little to a lot of weight, how many months or years before you finally are like, this is clearly how my body's going to be now? Does it vary person to person again?
It varies person to person. I think one of the things they never tell you if you're a woman is don't gain any more weight than you have to with pregnancy, because you gain beyond. A lot of women, they get pregnant and it's, oh my gosh,
it's
I can
open
just
season on
eat.
eating what you want.
Yeah, and that damages that skin permanently oftentimes, so that the breast, you see it in women that gain like 10 or 15 pounds. Their bodies generally look really good after having had the baby. However, those women that gain 60, 100 pounds, my gosh, their breasts are really droopy, and their stomach is really droopy.
It would be the same whether you're pregnant or not. If you gain a lot of
that's
weight,
true.
then it's going to
That's
stretch
true.
out your skin.
Ted?
Yeah,
Are you talking about
believe me.
yourself now?
yeah, but a lot of women.
I don't know, because once I gained the weight, it never went away.
Yeah.
So I don't know what happens after that.
But I hear that over and over from patients. If they had only told me that I couldn't gain all that weight without ruining my
I
body.
think they're better about it now. Not the women themselves. I'm talking like doctors and stuff telling women that fact, but it wasn't. They didn't tell women that for so long.
No.
Is it possible that your torso expands? I'm not talking about fat now. I'm talking about like maybe your organs or something, that your
rib
torso
cage.
gets wider when you're pregnant and then stays that way. Because I swear to you, I am thicker through the middle than I used to be. And maybe not even pregnancy, just as you age. But just like thicker in the trunk, but it's not necessarily fat.
It was that gangrenous appendix you had in there.
No, it's not the gangrenous appendix, though that can be blamed for many things. What about just getting wider as you age without necessarily it being chub?
We know that people who gain and lose a lot of weight, their rib cage actually gets wider.
I knew it.
and it doesn't come back. It doesn't
Well,
come
that's
back.
no good.
So if you look at someone who's gained, let's say 100 or even 50 pounds, and sometimes we see it most likely in the people that have gained a lot of weight, they end up with a really wide rib cage. So when we do an augmentation, for instance, we have to go with a much wider implant.
Can you shrink that rib cage down? Can you?
Break some ribs?
No, we can't.
Come on, do it.
You could. You have the tools.
Oh my goodness!
That was my rib cage shrinker device.
That was Dr. Workman, by the way.
Just repeat it. No, there's nothing we can do.
Sorry about that.
So talking again about fat and maybe like tummy tucks in the middle versus liposuction. There's fat right under the skin.
Correct. Subcutaneous fat.
Right. But there's like a second secret fat, isn't there?
Oh, mental fat.
No,
Deep fat.
not mental fat.
No.
It's like you can still be puffy, but it's not that first fat.
Intra-abdominal fat or mental fat.
Oh, he was
Oh, it's mental. I thought he was making a
mental.
joke.
Yeah. No. Mental. Deep fat. It surrounds the organs.
I'm pretty sure I got that fat.
Oh, no, you don't.
I'm pretty sure I do.
Oh, I don't see any fat on you, Daria.
Well, you're not looking hard enough.
You look beautiful.
But
How
that's
do you
why
get
you
that?
do like the core exercises and stuff like that to get the stuff in the middle,
But
right?
you can't liposuction that, I'm assuming.
No, you can't liposuction that deep fat, number one. Number two, that's the fat that's bad for you. That's the fat that causes your blood pressure to go up, that causes your blood sugar to go up, that causes your cholesterol to go up. And if you have too much fat surrounding your organs, you'll get what we call metabolic syndrome.
And that's
which
fat
is
on the
bad.
arteries.
Yeah, it's fat on the arteries, it's diabetes, it's a whole kabang, and it's all related to that intra-abdominal fat.
And you're telling me I got to diet and exercise that stuff away?
That's the only way we do it.
This is my last show.
I'm depressed. I need a burger or something.
No, but it's true. It's true.
With a tummy tuck, how far can you go? Like how you can go from like, say you've got, I don't know, like a 35-inch waist and you want to have a 25-inch waist.
I don't think you can go that far.
Yes, you can.
You're going too far, Daria.
You're just not trying, Dr.
Reasonably, how many inches can you shrink?
Probably 2 to 4 inches, depending upon what your anatomy is, once again, and how stretched out you are to begin with. If you're really stretched out, I mean, the ideal patient to have a tremendous difference is
Yes.
one that gained a lot of weight, lost it all, and now their organs are just kind of pushing everything out. That's the person, I mean, think of tummy tuck as a corset, as a surgical corset. The person that's, kind of big and lost that intra-abdominal weight, you can tighten up that corset really tight. They're going to have a dramatic difference.
After getting a tummy tuck, post-procedure in the recovery period, could you wear a corset?
You probably have to.
Oh,
don't you?
absolutely. Yeah, we will put a corset on you right afterwards. It's called an abdominal binder that kind
Yeah,
of
but it's
takes
not the
pressure.
corset I'm picturing, Dr. Workman. It's not. It's
Something
not.
sexy?
Yeah, it's not
Yeah.
black and red brocade.
No, that's true.
But could you wear one of those
You
over
could. You could, but we
Yeah,
want to be
this is
careful.
sounding better
You
and
just want
better.
to cinch it
Oh,
up to
yeah.
nothing.
I want Jessica Rabbit proportions, and I'm finding it very irritating that I can't have them. Dr. Michael Workman, one of the very, very best in his field, certainly in this area, and you can find out all sorts of information about procedures that you didn't even know possible. It may be much simpler than you thought. It may be much quicker and easier than you thought, and it very likely will be more affordable than you thought. Check out his website, drmichaelworkman.com.
Seminar this week, right?
That's right. I'll see you
Oh,
tomorrow
tomorrow
night.
night, yeah.
Where is that again? I should probably know this.
Yeah. I know Dr. Workman doesn't know.
I don't know.
Stand
I
by.
think it's 6:30.
It's
Yeah.
3doctorsOneGoal.com. If
Yep,
you want to
Dr.
register,
Chan will be there.
All the
and,
info's there. 3doctorsOneGoal.com.
I'll talk about it a lot tomorrow
Okay.
because the location has escaped me. But you'll probably have to remind me to go tomorrow. I'll be
I'll
like,
remind you.
something, you're going to have to.
Oh, you're
I'll
gonna be
like,
there, aren't you?
Something
Yep.
I got to do, something I got to do. And then, it'll be, yes. I'll be
Okay.
there. I'll bring a corset. We'll discuss.
Excellent.
various-
Cinch it up.
yeah,
Hold on.
Excellent.
Here we go. Here's the
Thank
information.
you, my love.
It's
Oh,
at
there
the
we go.
Sentinel Hotel, which is 614
Oh, that's
11th
the governor.
Avenue.
That's what used to be the governor.
Okay.
Okay.
So it used to be the Governor Hotel. Yeah, at 6:30 tomorrow night.
I'll see you there.
Okay.
Most likely. Thanks, Doc.